completely disappeared up to now.
Oh.
And I had better sleep. I feel much healthier, more flexible. You know, at our age, flexibility is something that we have to be thankful for. And that's it. I improved much on this triangle of health, and I'm taking it regularly. Yeah.
Wonderful. Thank you for sharing that, no, Dr. Vincent. Now tell us the story of the other doctor in your clinic, your colleague who shares the clinic with you. I know you have a beautiful story of that friend of yours.
Yes, well, I asked his permission that I will tell his story, but I will not name this doctor.
Okay.
Unfortunately, I don't think he's now here because he's doing rounds of his COVID patients. He does it after his clinic hours, so I think he's still at the hospitals now. But this is his story on how he knew of the triangle of health. This doctor shares my clinic. I do my clinics in the morning and then he does it in the afternoon. He's a pulmonologist. And he was curious on what these patients were getting from my secretary, my medical secretary. We share a common medical secretary. And he often sees these products which my patients get from my secretary. So curiosity made him ask what are those products, and my secretary is now an expert on the Kayani Triangle of Health. She knows how to explain what these are. So she explained this to this doctor. And this doctor has had a COVID patient, was taking care of one of these COVID patients, which is a problem for him because this COVID patient has been on the ventilator for more than 3 weeks now. And every time he tries to lower down or wean the patient from the ventilator, the oxygen saturation goes down. So it already reached 3 weeks and he could not wean this patient from the respirator. So probably out of desperation, she asked my secretary, can I borrow those the supplements that you are telling me? Because you told me that these are antioxidants and the nitric oxide. And we have heard from the comprehensive explanations of Dr. Joe that the basic pathology of COVID is the effect on the immune system and the existence of oxidative stress brought about by the free radicals, as well as the inflammation in COVID patients. And the most dreaded inflammatory reaction for COVID patients is what we call the cytokine storm. No? This is a very severe form of inflammation. So she asked my secretary if he could borrow the trial packs for the Triangle of Health, and he gave this to his patient. And after 3 days, he noted the oxygen saturation to be more stable, and he was able to slowly wean the patient from the ventilator. And on the 10th day, he was able to discharge this patient. And this patient claimed that he became well because of this Triangle of Health. And this patient is also now an advocate of our Kayani Triangle of Health.
That's amazing. That's an amazing story, no? So now your friend who did not believe you in the beginning is now an advocate also of wellness through supplementation.
Well, I cannot say that he did not believe me, but because of his curiosity, he learned about the triangle of health, and now I'm
Yes.
proud to say that he is another advocate of this Kayani
Wonderful.
triangle of health to his patients
I'm
and
happy
to
to
his
hear that,
relatives
no?
and family. Yeah.
Yeah, I love hearing these stories, Doc, because these stories really give us hope, no, in these very difficult times. Now, you also have another doctor friend who himself was a COVID patient. Please tell us that story, Dr. Vincent.
Well, I remember telling you this story when we had this diamond meeting when you told us to what is your good story for today? You know, you asked us that,
Yes.
and I remember
Yes.
this. He's a friend of mine. I know he's watching now. I asked also his permission for me to tell his story. This friend of mine is a skeptic. I can tell because I tried to introduce Kayani to him several times, but every time he evades my introduction to him of this Kayani triangle of health. The sad part is that despite his very athletic lifestyle, he's very picky in his diet. He has a lean body. Actually, he is a military person. He's a doctor in the military. He's a retired brigadier general. So he leads a healthy life. The reason why he leads a healthy life is because of he has this it runs in their genes, no, yung heredity factor that like for example his father, his uncle, all of them died because of heart attack, heart disease at the age of during their 60s. So this made him careful and took care of his health. But unfortunately, he got the COVID infection. He had fever for 5 days when I was chatting with him on the messenger, diarrhea, weakness, and muscle and body pain. I told him, these are signs of COVID. Why don't you take the test? So he took the test and eventually he was admitted to the hospital. After 2 days in the emergency room, he was admitted because of chest pain and pneumonia, which was seen through the CT scan. So for us doctors, we stick to the protocol, the therapeutic protocol on treating patients with COVID. Before I even attempt giving my COVID patients a Kayani triangle of health, I first make sure that these patients being treated according to what we have learned scientifically on how to treat COVID patients. So this friend of mine was receiving the antiviral, and he told me that most probably he will be staying for 5 days just to complete his antiviral regimen. But after 5 days, he was still in the hospital, looking more worse than before he entered, because now his x-rays, not only the CT scan, is the ordinary x-ray that showed that he has pneumonia. So he was told to stay longer to extend the antivirals that was given to him. And then after 7 days, I thought he was going to be discharged. But when I had a chat with him, with online chat with Messenger, he was more depressed. And this was because the parameters like the D-dimer and the ferritin were super high. Like the D-dimer was more than twice the normal. And this parameters...
What is the meaning of those, the parameters being high? What is the impact of that though? In simple layman's terms.
In layman's terms is that once these are positive or elevated, you have severe COVID.
I see.
So okay. He has severe COVID. And during the course of our conversation, he told me just basta nasabi niya lang, magkikita pa kaya tayo. And this struck me. And my plan was to give him the triangle of health once he is discharged. But because of this situation, I told him, whether you like it or not, I will give you the triangle of health. And once this package reaches you, please call me again to the messenger so I'll teach you how to use it. Pinadala ko na po kagad yung aking mga at least four the packages of the trial packs of the triangle of health. Once it reached him that day, I asked him to take it religiously and how to take it. I double dosed the sunrise and the sunset, and every 2 hours the nitric oxide, nitro. And we learned from the explanation of Dr. Joe how this triangle of health can act as antioxidants against the free radicals and oxidative stress present in patients with infection. And the nitric oxide, the effect on the blood vessels, and for the inflammation, most probably, I believe that it could help. So with prayers and with my trust on the Kayani Triangle of Health, every day I called this friend of mine. The following day, looks like there are signs of him getting better, and he was now taking the Kayani Triangle of Health seriously, and he was reading the included, the
literature, yeah,
the literature.
Yes.
On the third day, he told me that nagja-jogging na ako dito sa room eh. He was already walking around the room for a little exercise.
Wow.
So I did not, I saw a lot of improvement from him. And on the fourth day when I called him up, he was already on his way home. Nasa kotse na po siya on his way home. He was already discharged from the hospital. After 5 days at home, he was feeling better every day. He goes around his plant, his garden. Meron po siyang mga halaman doon. Sabi niya, nalanta na itong mga halaman ko. So he was watering all his plants. He was feeling much better doing his exercise. And although it was not required for him to have a repeat RT-PCR swab test, he had it done. And then he called me up, look, I'm already negative for the swab test. So it was negative on the 5th day at home. And then later on, he had his D-dimer and CBC as well as creatinine. Those are blood tests. And lo and behold, he was very proudly telling me that his D-dimer, which rose up to 1,000 plus, more than twice the normal, is now below the upper limit, which is 5. It's now 200. It's within the normal. So wala na pong signs ng COVID.
Wow.
And just for that, his experience, he's very interested now in Kayani, and he is now an advocate of Kayani as well. And I know just today he gave the Kayani Triangle of Health to one of his friend who is also confined now at the hospital. And let us all pray that with the triangle of health and with the medications, etc., that his friend will also will survive this COVID experience just like him.
Wow. Thank you for that story. And I'm so happy that your friend got better, no, Dr. Vince? I know that you have a lot of diabetic patients who take the triangle of health also as part of their nutritional support, no? And how has this protected them from, all this COVID happening around us? Very quickly lang po.
So as of now, I'm more on online teleconsultations, no? And
Yes.
it is really very sad that a lot of people are suffering or are getting this COVID infection. Actually, families are getting infected, and they contact me through online consultation. I have this family. One of them is my patient, and I already am giving him the triangle of health. And so far, all the members of the family are positive for COVID except him.
Really?
That is just
super
that is just
amazing.
one. That's just one. And another family of my another patient of mine, the whole family also got COVID. And the reason why they teleconsulted me was that the mother was quite had moderate already difficulty of breathing. So I asked her to have this home package on how to treat on the treatment of COVID. And these home packages, although they're quite expensive, they a doctor will come visit you, put an IV line on you, and start you on packages. Although they're quite expensive, they a doctor will come visit you, put an IV line on you, and start you on the antibiotics and the therapeutics needed for the treatment of COVID. So when I saw that this was started, I told her to include to support her immune system, this Kayani Triangle of Health. So the first consultation, she was on oxygen and with the difficulty of breathing. After 3 days, she no longer had this oxygen on her. And after a week, when she consulted, all of them, all the family members, the sons, daughters who were positive, including her, are now negative for COVID, and they have fully recovered just within a 1 week period, 1 week time.
That's very powerful sharing, Dr. Vincent. Thank you. Thank you for all your stories. No, we are already inviting Dr. Joe to join us in this forum for the Q&A portion. And I just want to request the doctors to keep their answers short and direct to the point, because we have time that we are observing here. Dr. Joe, very quickly, is the virus airborne? Is the COVID virus airborne?